to give you a gist, I've been a nutritionist for the past 22 years, and I've worked in India as well as abroad, and I've been certified and have licenses in other countries also to practice. So I've been doing nutrition since 1997. That is when I graduated, and this has been my forte. Thank you very much, Insure My team and Riddhi, for giving me this opportunity. Without wasting much time, I think we should start off with the presentation, and then I can take whatever question answers our participants have for today.
Definitely.
So, as rightly said, we are celebrating Diabetes Day, World Diabetes Day today. And to start off, I'll be talking about diabetes, the signs and symptoms, what are the risk factors, how as a nutritionist, I will be able to help you with the role of different lifestyle changes, nutrition, diet, exercise to help either prevent or manage the diabetic condition that any one of you is going through. So diabetes, as we know it, लोग बोलते हैं कि वो मुझे शुगर की बीमारी है, मेरा शुगर बढ़ गया है, या can you hear? Am I audible?
Yes, you are audible.
Okay. So we normally address diabetes as sugar ki bimari. Now, what is basically diabetes? Diabetes is a mixture or a group of metabolic disorders that is characterized by blood sugar levels which are constantly high or which are high for a very long period of time. A person having high blood sugar, let's say for 6 months, 8 months, this person may be considered, after of course a lot of other tests that we go through, to be categorized in the diabetic category. How did this name diabetes come in? So there were these Greek physiologists and medical people who long back in the year, more than let's say 500, 600 years back, they discovered that a person who is suffering from this particular condition is having excessive urination. So they named it and termed it as diabetes. But in the Indian context, we have the Ayurvedic doctors who were there in the year 1500 BC, where they found out that this particular group of people had a lot of mixture of complications. Some had, heart problems, some had kidney problem. But one thing that was common in all of these patients that they were seeing is that their urine samples, when taken out for other testing, they were attracting ants. So they named it as Madhu Meha. Madhu means honey and Meha means urine. That is how it was addressed previously in our Indian medicine. Now, when we say that, a person is diabetic, how do we come and check, or how do we insist on a particular person to go through the test that will determine whether that person is a diabetic or not? Make sure that you by heart these 3 T's that I have written here, but there is no P that is seen here. Let me tell you what it is. The first one that you need to be very aware of is frequent urination. Frequent urination is called as polyuria. Poly is many times, and urea, of course, is referring to the urination. The second one is increased thirst. So that is called as polydipsia. Dipsia is something to do with water. Poly, we've already discussed. And the third one is increased appetite. Increased appetite is polyphagia. So if you go through any of these symptoms which starts with polyuria, polyphagia, polydipsia, there are very many chances that, you might be, susceptible to this particular diabetic condition. Now, these are the common symptoms that I'm talking about. Acute complications can be, when you do your test for something else. Let's say you have high blood pressure and you've gone in for a routine check, and in your urine there are a lot of ketone bodies. Or if you're going through, high sugar levels sometimes, and then suddenly feeling low, energy levels are dropping, then yes, of course, you should go in for the diabetic test. Cardiovascular diseases, foot ulcers, damage to the nerves, these are all stages where, of course, by then we have already determined that that particular person is suffering from this condition. So you have to be sure of these small symptoms as well as symptoms that may lead to even death in some cases. Now, I have already told you what the signs and symptoms are. So all the 3 P's are put up there. If you undergo weight loss, which is all of a sudden, like you're doing nothing, you're already on the ideal weight, but there's a lot of, wasting of your body fat or muscles, you have suddenly grown very, very thin, then yes, of course, you need to be alert. Fatigue, like I already mentioned. Frequency of infections. So especially for women, if there is if they undergo something like vaginal infections, if there's a lot of fungal infection, UTI, we all go to the gym, we use common washrooms, we go to the mall. If you feel you are susceptible to UTIs frequently, then please get your sugars test done. In men, if you're always feeling tired, let's say you've done 2 or 3 hours of office work and you're suddenly feeling very sleepy, or even if your breath is like fruity, you just try and test your breath any time of the day and you're feeling a slight sweetness, a sweety odor to it. Or if you have real dry mouth, that it's a polydipsia, like you're actually feeling thirsty all the time, then of course dry mouth is one of the signs where you can go and get yourself tested for diabetes mellitus. Then we come to what exactly the diabetes onset is. When is it happening? Why is it happening? How is it happening? To know when, what, why, we need to understand what are the types of diabetes that a person is probably exposed to. The first kind of diabetes, which is called as the type 1 diabetes, can occur because of when you're born. Okay, it's basically called the juvenile diabetes, which means diabetes which is a childhood diabetes. Your pancreas have beta cells and they are the ones who produce insulin in your body. Suppose there is a malfunctioning and there is no production of insulin in your body by birth, then you are known to be insulin dependent diabetic mellitic, which means your body is not able to produce insulin at all. Then of course you have to depend on insulin to try and control the levels of sugar in your body. That is the first type of diabetes. There it is, the known cause of why some children are born with this particular malfunctioning is not yet determined, but we tag it right now as an autoimmune disorder. The second type of diabetes, which is 80% of individuals in today's world are going through this particular kind of diabetes. It is very commonly known as insulin resistancy, or it's called non-insulin diabetes mellitus. Non-insulin diabetes mellitus, which means your body is producing insulin, but the body cells are not responding to the production of this hormone. So there is a problem in utilizing the insulin that is produced. So here what happens, basically the beta cells of your pancreas are working properly. You are a normal individual. Over the years, because of lifestyle changes, because of excessive body weight, because we are not exercising enough, there is a kind of a resistancy that comes to utilizing this particular hormone, and because of which you end up having type 2 diabetes. So most of us who are here right now, by the year 2050, every second person, if you're sitting next to somebody in the office, every second person would be a diabetic in India. So it's high time that we understand what this condition is and take actions to try and prevent or, push the complications as much as possible away from us. The third type of diabetes is called as gestational diabetes, which means this diabetes is it's present in a particular individual's life only for a certain period of time. And as you know it, gestational means pregnancy. So it occurs almost 100% in women. And this comes around second and third trimester of their pregnancy period, wherein suddenly the sugar levels are uncontrolled. And these particular individuals, we don't know the cause yet, but most of them either have a previous history of diabetes in their family, or they have other morbidities, which I'll come to in the next slides to come. So when we are talking about diabetes, we've already seen that there are three types of diabetes. There is one more type of diabetes which does not get as much mention because this is a diabetic state in an individual's life which is caused either by long-term drug abuse, if you're taking something like steroids, if you have undergone cystic fibrosis. So there is this other form of diabetes, again, that can be reversed. So it's not tagged as diabetes, but yes, the sugar levels definitely go non-controllable in these stages. So we have seen type 1, type 2, gestational, as well as other forms of diabetes. Now, how do we manage diabetes? Suppose a person has got diabetes. What do you do basically? So we go to the doctor, we ask for medication. So type 1 diabetes, where for no fault of that person, he is born with this particular malfunctioning where the insulin production is not there, then the doctor advises insulin injections. Of course, you will have to maintain a regular, lifestyle where you do your exercise, diet, physical activities. Try to be as close to your BMI as possible. So this basically, because it is juvenile, children try to manage it right from childhood, and most of the cases, it is still not, in the severe stage. But when we are talking about adults, okay, what happens is, yes, we do go to the doctors, we do get the medication, but we are not able to follow the timings, we are not able to follow the dosages. We try and, first of all, as adult individuals, to accept that you are diabetic itself is a big challenge. So as a diabetic educator, when I went through that training program and got certified, I realized that it is not only, prescribing a diet and giving to the person who is undergoing this condition. It is a lot to do with acceptance, self-management, self-care, self-belief that, yes, I can try and control my sugar levels. I can do it. So it's a wholesome kind of an approach that the person who's suffering from diabetes needs to specially control type 2 diabetes. So here we have mentioned that, controlling your blood sugar, yes, one thing. Trying and taking oral medications to sensitize your body to the insulin that is produced is second thing. The third and most important thing is control of blood pressure. So if you are able to control your blood pressure and take care of your, other vital organs, especially eyes, eye care, foot care, personal hygiene. Like I mentioned, there is a fruity odor that comes in. So oral health is as much important. So if you start doing small little things, it will, get you towards healthier sugar levels when you're suffering with type 2 diabetes. Now, I've closely been working with a bariatric surgeon, and we have seen in our hospital, if a person who is extremely obese, let's say his BMI is around 35 and above, then they are eligible to go through a kind of a weight loss surgery. It is more of medical based than cosmetic. Yes, of course, we have a lot of celebrities who go through the knife to project a slimmer look, etc. But here we are purely talking about the medical benefits. So if a person is suffering from, let's say, uncontrolled blood pressure, okay, he is extremely hypertensive, he is prone to have cardiac problems, then we do get them to get into the bariatric surgery. And once the process is done, even their sugar levels come under control. To put it in this platform, there is no said cure as of now for diabetes, but yes, we can try and control the episodes that may cause further damage to our system. Now, like I had mentioned, there is a fourth type of diabetes that can happen to any individual. So if you are not a juvenile diabetic, if you are maintaining a healthy lifestyle, if you're having a proper diet regime, if you are within your normal BMI, and if you have not taken any medication, okay, or if you're not pregnant, then of course we are all safe. We are not in that susceptible category of getting diabetes. But hold on, if you have genetic defects, if there is a problem with the processing of the insulin that is produced and the functioning of your receptors, if there is mutation in your insulin receptor cells, then there can be a problem. If you have any problem with your most important organ, that is the pancreas, since we are talking about diabetes, if you have chronic pancreatitis, if you have cystic fibrosis, if there is a problem with your neoplasia, if there are these kind of complications, then you are susceptible. If there is any problem with your growth, if there are hormonal disturbances, including thyroid, even if you're hyperthyroid or you're hypothyroid, if there is some kind of infection, then yes, there are two infections that have been mentioned here. So one is Coxsackie virus. If that, it's a very rare condition, or like I had mentioned, some steroids and drugs, if you have taken it, that is the other type of diabetes that you are at risk in. So it seems quite difficult for us to escape, getting into the pre-diabetic or diabetic bracket as of today. So, okay, now we know what are the types of diabetes. We know what are the signs and symptoms. We've understood what category we may be, in, where we are prone to getting diabetes. Let's say I have fruity breath. Let's say I get fatigued during the day. I am frequenting the washroom. I'm having a lot of dry mouth. Let's say we have certain conditions like this, or I've just undergone a urinary tract infection and I've just come out of it. If these are the signs, like I mentioned, it is your duty to go get help from a healthcare professional and ask them to get your blood diagnosis done. Now, when we do the blood test for diabetes mellitus, what do? We check the fasting glucose level, we check the PP, we call it, so postprandial plasma sugar levels, we check, or we check the HbA1c levels. Now, since traditionally we've been doing either the glucose tolerance test, so we give you a glucose water, you drink it, we wait for an hour, then check your blood sugar, then again we administer another glucose glass of glucose water to you. That has been going on for quite some time, which is called as the glucose tolerance test. It is one of the vital indicators of understanding whether you're diabetic or not. Of course, fasting, we all now, everybody knows what are the fasting levels, what are the post lunch or post dinner levels. The most important diagnosis as of today that you need to make sure that your physician or your healthcare professional tells you and insists you on doing is the glycated hemoglobin, which is the A1C levels. Why? Because once you do this test, you don't have to repeat it for a minimum of 3 to 6 months. Imagine a diabetic who has been pricking himself or herself every day and night to check their sugar levels. If they get a chance to just check their levels once in, let's say, 3 months, how good can it be? So that particular parameter is of utmost importance. And to be very honest, now there are a lot of other gadgets or devices that are available in the market where you can check your sugar levels even continuously. So there's a patch, you just apply it on your arm, normally it's your left arm that, you apply the patch on. So you've inserted that patch. Once in 15 days, you have to remove that patch. Continuous monitoring takes place. And you know what works for you, how your sugar levels are when you're having a particular food group, how your sugar levels are when you're exercising, and so on. So here we mentioned the WHO criteria of what is normal. So let's say let's say the glucose water test that I was talking about, there the normal levels are under 140, and for fasting it is under 110. For HbA1c it is under 6.0. If any of you have undergone the HbA1c levels, and if you are, let's say, somewhere around 5.9, still we consider you as a pre-diabetic. And if you cross 6.5, then you are 100% diabetic. And reversing that particular phase gets very, very tough. So it's best that, after whatever we speak today, at least if you can get your HbA1c levels, you will be sure of what your future stands for the next 6 months to 8 months. And people who have their HbA1c levels lesser than, let's say, 6 or 6.5 can relax, but make sure that you continue doing your lifestyle and dietary changes. So now, let's say a person has already got diabetes. Well, let's say my HbA1c levels are 7.5. I am 100% a diabetic because 6.5 above is considered to be a diabetic. So if I have been tagged as a diabetic, what happens? Let's take from the head to toe. So first we start with the brain, cerebrovascular diseases. So anything to do with the brain. If you know, the endocrine gland produces a lot of hormones, enzymes in our body. If the brain gets hampered, all of that will be affected, including your insulin resistance. Eyes, yes, diabetic care during, eye care during diabetes is, it's just like you just have to take care, because if you start accumulating glycation on your, eye lens, etc., it's going to solidify blurry vision. It starts with, and then it ends up in either, you losing your eyesight or getting into a cataract operation. We want to avoid all that. So you have to start from your head. So brain, then comes your eyes, then teeth. I told you oral health is extremely important. Of course, the nervous system. If you know, diabetic people, they have very less sensation on their hands, legs. That's why they get hurt and they don't realize that, they have an injury. And it takes a lot of time for the injury to heal. And it's a sad state. I'll come to what complications you go through if you are ever faced such condition. Heart, again, like I mentioned, blood pressure, hypertension, one of the main factors of you ending up having uncontrolled diabetes. So blood pressure, of course, heart related, you will have to take care of that. Kidneys, why? Because if there is excess production of glucose, ketone bodies, the kidney is constantly under pressure, and that can lead to kidney diseases or nephropathy. Now here we've just given you a gist of what are the harmful effects. So eye disease, kidney disease, central nervous system, even your digestion gets affected. Of course, when insulin is not produced, how will you be able to increase the permeability of your cells? How will the glucose reach the, the cells, and how will there be nourishment? How will you convert it into energy? That is why you feel fatigue. So it's a continuous cycle. So all your biochemical conditions of your body, including your digestion, gets hampered if you have diabetes. Numbness in the feet, we just spoke about it. Loss of hearing, gum problems, skin infections, because you get hurt, you don't realize, or dry skin, scaly skin. These are the conditions that diabetic people go through. And last but not the least, here we have mentioned sleep apnea. It's a very serious condition. If you snore a lot, if you're breathless, if you get up often in your sleep, please go ahead and get your blood sugars done. Now, as we spoke about each organ being affected, if you just take an example, I'll just take any example. Let's say, kidney. So if you have high blood pressure, there's damage to your small blood vessels. Of course, there is excess of blood glucose. I already told you. So the kidney, poor thing, is constantly trying to keep flushing toxins out of your body. And of course, it hampers the kidney functioning, resulting in nephropathy. If you take something like brain, again, if there's not enough energy to your cells, less of oxygen reaches your brain, risk of stroke. It's also going to impair your cognitive development. So be very, very cautious. I want you to take it seriously. If a person, whoever is listening to me, if any one of you is diabetic, I'm sure you must have undergone one or the other, minor or major. So here we have mentioned microvascular and macrovascular, but I will not divide it as such. I will say every condition or every complication of diabetes is macro. Take it extremely seriously. Then we come to, like I had mentioned, there is no prevention or cure to diabetes. We can only postpone, since the statistics show that in India, by the year 2050, every person next to you may end up having diabetes. We can only push ourselves to not get into that category as much as possible. So there is no preventive measure for type 1 diabetes because it's a birth defect, like I mentioned. Type 2, here, if you don't maintain your normal body weight, then you are susceptible. If you smoke tobacco, you are susceptible. If you don't change your dietary lifestyle, you are susceptible. If you don't, especially like I had mentioned, blood pressure, it's also to do with your cholesterol. So if I just say there are 5 things that you need to do to push getting into the diabetic category on present day scenario. One would be, of course, your body weight. Second would be smoking. Third would be exercise. And fourth will be your fats or cholesterol, definitely. And fifth will be the attitude. Of course, genes play a role, but the attitude towards your self-care, how cautious you can be, being alert, being mindful. These are the 5 pointers that you need to be very, very closely, you need to monitor it closely to help you prevent getting into this diabetic category. Now, here I've also mentioned what are the factors you can't fix. So we've already discussed it, but this chart will show you a gist of what I was talking about. So I'm 45 plus. I know many of you who are listening to me, who are working in the corporate, maybe 45 or older than that. Then yes, we can't really push it as far. Gestational, no choice. If you're pregnant and you undergo diabetes during that phase, you can't do anything. If close relatives of yours, let's say your sibling, your parents, your grandparents, if any of them have had diabetes or are suffering, then you can't really do much about it. Medical conditions. So any condition that I spoke about here, including your brain, kidney, nervous system, if you are undergoing any kind of morbidities, then comorbidities, definitely diabetes is going to follow. High risk ethnic background. Now, ethnic background, if you see, most of us who are listening to this presentation today, we are all from the Indian origin. And sadly, we are in that susceptible high risk background. So it will not definitely be we have very less chance of running away from it. Factors that you can improve, even in spite of having these conditions, you can do higher level of activity. So be more active, physically active. Cholesterol. Make sure that you try and control your cholesterol levels. BP, I've been saying right from the time we started the presentation, and your height to weight ratio. So be in the normal BMI category, which is a cutoff of 25 internationally. And for Indians, it is around 22.9. So if you are under that category, then maybe we'll be able to, manage it a little more. Now, as we were talking, I mentioned that there are 4 or 5 pointers that you need to keep in mind. One thing, as a dietitian, I've been an obesity expert for the last 16 years now. I've been in the wellness industry. So we closely monitor weight loss, a very big parameter. Here, I want to give you one tip. Suppose, people say, oh, you're a diabetic. Now you have to go on a diabetic plan. You'll have to keep checking your what you put into your mouth, go on a no carbohydrate diet. Please do not have sugars, etc. My suggestion, if you are diabetic and if you are obese or overweight, just go for a weight loss diet. Once you start cutting down on the amount of calories you're having, and once you increase your physical activity and increase the output of calories from your body, diabetes will apne aap, it will come under control. You don't have to really go into any special diet as such. So this is my tip from an expert who's been doing this for a long time. Then we talk about, so we spoke about exercise. Of course, we all know exercise not only, gives us physical fitness, it also gives us mental fitness. Every small amount, every step that you take. So to be very honest, if we have a diabetic patient who is, let's say, above 60 and she has arthritis or she's not physically active, the only exercise we tell them to do is after every meal, please take 100 steps. It has been traditionally followed as well in many cultures. So even if you practice that, every step that you take towards physical fitness counts in your diabetic management. So now I come to my forte, that is diet. So what do we do when we have a person who is suffering with diabetes? So there are diabetic diets that are taught to us when we have done our education. If you see the chart here, nothing great that is mentioned here. The only thing that I want you to actually concentrate on is to see all the food groups. So we have the carbohydrates, we have the fruits, milk, vegetables, we have the protein, fat, all of this. Plus we have the miscellaneous. So if you just put a glance, you know that nothing is omitted and nothing has to be had in excess. So this is the idea. But I will also give you some more information, since we are talking about what and how nutrition plays a role in diabetic management. So when you have to follow a diabetic diet, there are 3 diets that I have mentioned here. The first diet that you can just go check it out, see what the principles are, and try and implement at least 60 to 70% of that particular diet, rules and norms. So the first diet that really gives very good results if you are a diabetic is the Mediterranean diet. So if you see the Mediterranean diet here, it's mentioned that you need to have a lot of vegetables. They have mentioned olives because it's Mediterranean, so it comes from there. It's found in excess in that region, so you can go in for olives. No harm in it. Olive oil, or I would say any oil from plant sources, you can go in for that. Nowadays it's again back in the market where people are switching from refined oils to cold press, etc. Cold press oils are really good. I will also suggest you, if you are going to be getting into a proper dietary management, cold press oils, any oil, whether it's coconut oil, peanut oil, sunflower oil, please go for cold press oils. They give more benefits. You are less susceptible to carcinogens. So go for that. Then here they've given like tomatoes, just because of its color and an enzyme called lycopene that it produces. It's an anti-aging ingredient. It's a potion actually. So it's high in antioxidants. It also fights cancer. So as much possible, if you can incorporate tomato and other beta carotene rich foods in your diet, it's good to go. Fiber, of course. So if you have diabetes, time and again people tell me that I skip carbs. Please do not skip carbs. Go for wholesome grains, whole foods, cut down white as much as possible. So if you're going to have a plain bowl of white rice, I would suggest make a khichdi out of it, or add some vegetables to it, make a pulao, okay, or have a combination of, let's say, an egg curry with rice, or a chicken gravy with rice, etc., so that you're trying to make it wholesome, and the sugar spike that may happen because of simple carbs in your diet can be lowered. Since we are talking about sugar spike, I was just going through one of the articles, and here we have something called as the glycemic index of food. No matter what diet you are in, glycemic index of food makes a big difference. I will be sharing it again with Riddhi, and she can obviously share it with all of you who are present here. So there is a chart like this. I am not sure if it's clearly seen here. Anyways, I'll share it when we finish the presentation. Just to give you an example, not all foods that are tagged healthy is healthy for a condition like diabetes. So let's say a person says, I'm having a bowl of fruit, okay, as against to a person who's, let's say, having let's say pizza, okay. For a diabetic, if you are having a slice of pizza, the glycemic index is 30, which is in the green category, as against a bowl of watermelon where the glycemic index is 72. So what does this glycemic index mean? So when you are having, let's say, a slice of pizza, you eat it, and after about half an hour, 45 minutes, the sugar release, or the whatever you've eaten, the energy release takes place in your body, and there is a sudden spike of glucose level in your blood. This spike of sugar is called the glycemic index. So for a pizza, slice of pizza, it's 30, okay, and anything below 50 is fine to go. It's good to go as a diabetic person. And if you're having a bowl of watermelon, the spike is 72, which is in the red zone. So please do not categorize any food as, healthy and unhealthy. You, as a diabetic, here I'm trying to tell you, as a good dietitian, you can even have a slice of pizza, but monitor how much of portion size you're having, okay, and you can go for any food, even watermelon. For that instance, like I mentioned here, a bowl of watermelon is going to spike it up to 72. If you're having, let's say, 5 to 6 pieces or blocks of normal sized blocks of watermelon at a time, and then giving a gap of 1.5 hours, and then again having another 4 5 pieces, it's not going to spike your blood sugar levels. So there, the glycemic index plays a big role. So this is a giveaway for you today. You can go and do the reference, check for the glycemic index of different food categories and inculcate it in your diet. We spoke about whole grains here. Of course, fish, a very good source of omega and protein, amazing fatty acids. Do not shy away from that. Yes, the way you make it makes a difference. The amount of oil you use in it makes a difference. Salt, spices, all of this will make a difference when you are trying to manage your sugar control. Red wine, yes, a beautiful antioxidant. Again, 30 ml is what you can have. I would suggest you having it twice, maximum thrice in a week, not more than that. If you are a diabetic, abstinence from alcohol is definitely going to do a lot to you. So that's the first diet that I spoke about. So the Mediterranean diet, one of the best diets in the world, has shown good results for diabetic management. The second diet is a low carbohydrate diet. Don't confuse it with a no carbohydrate diet. People just keep on, I got diabetes, I have stopped eating rotis, I've stopped eating rice, I only have, protein, and I'm having salads. I'm not having anything else in my diet. Please do not go for such extreme diets, okay? Control the portion size, go for wholesome foods like I mentioned. Carbohydrate foods can be, in a way, helping you in trying to maintain the sugar levels. Like I mentioned here, a slice of pizza is also helping you maintain the sugar levels. So you can go for a low carbohydrate diet, which has shown good results. I don't think you need any explanation for that diet. The third and one of the most interesting diet here is the DASH diet. So it is nothing but dietary approach to stop hypertension. So this particular diet uh, has shown extremely good results in the control and management of diabetes. There's a huge list of things that you can do, how much you can eat, portion sizes are mentioned, what are the options. Let's say beans, nuts, and seeds. It's clearly mentioned here: almonds, walnuts, sunflower seeds, peanuts, peanut butter, kidney beans, all of these, lentils. These are the ones that you need to incorporate, and how much of it and how much portion per week, all of that is given here. So you can refer and of course start implementing it in your lifestyle. Then we talk about like I mentioned, yeah, for overweight people, you don't have to really do any diet but a weight loss diet to get maximum results. And eventually your blood sugars are also going to come under control. Then we talk about, of course, I've already told you about 3 diets: Mediterranean diet, low carbohydrate diet, DASH diet. Now, what we are going to talk about is how should your plate look. So in Indian context, our thali is around 12 inches. So if you're a diabetic, go for a slightly smaller plate. So a 9-inch plate, a hotel, a normal restaurant plate. So go for that. 1/4 you'll fill with starchy vegetables, or your rice, or quinoa, or oats, or brown rice, basmati rice, anything, red rice, matta rice. You can have any of those, but only 1/4 of that plate. 1/4 will be your protein. So if you're a vegetarian, you can go in for tofu, you can go in for mushrooms, beans, lentils, whatnot. If you're a non-vegetarian, like I mentioned, fish gives you maximum benefits. Fish or even chicken can be had, egg can be had. So you can go in for the portion size as 1/4 of the plate. Then you have half the plate filled with non-starchy vegetables. So there are 2 types of vegetables that we have, category A and B. One is the starchy one that we already spoke about, and the other one is the non-starchy one. So more of greens, more of water-filled vegetables, lauki, and you have your bottle gourd, pumpkin, all of these come under this category. And of course, a small little portion of dairy. So you can go in for either yogurt, Greek yogurt, low fat yogurt, no fat yogurt, homemade yogurt. I'm fine with any of these. Go for 1 portion of that, and a small amount of fruits. So again, here we have mentioned very clearly the portion size definitely matters. So we've written here that you go for low in sugar, refined carbohydrates, you will have to avoid. You have to have high fiber, so more of raw vegetables and fruits. And if you are insulin dependent, okay, this is a very important message that I need to give you. Though we are talking in this platform and I'm giving you a lot of tips and instructions, please do not self-medicate. Please do not go on a self-induced Googled diet. Why? Because if you are especially an insulin dependent diabetic, then we need to check whether your insulin is long lasting insulin. Is it a quick action insulin? Whether it's going to be a medium acting insulin. There are different categories. The doctor must have understood your physiology and your medical reports, and then suggested a particular brand and how many units. So as dietitians, we need to calculate per gram carbohydrate for a international unit of insulin that has been administered to you. This is called as precision nutrition, and we do individualized diet plans depending on this. Yes, it will only include your normal boring vegetables, fruits, and the normal food diets. There's not going to be any extravagant. I told you there are only 3 diets that are going to show results to you. So we'll play around with those 3 diets only. But how much to eat when? Extremely important. Another, so one, if you have insulin, if you're insulin dependent, then the units matter, the carbohydrates matter. If you are non-insulin, and if you, let's say, at night you have this, it's called as nocturnal hypoglycemia. So when you're sleeping, you have nightmares, you get restless, you're not able to sleep, there's constant headache. If you are sweating out in the night, then there are possibilities that your sugar levels are dropping down. If we see time and again your sugar levels going down below 108, okay, during the night hours, then we need to give you long acting carbohydrates. So again, there a dietitian plays a very important role. We don't want you to end up in diabetic coma, and that is why during the bedtime for diabetic people also, we either suggest, a fruit bowl with some nuts into it, or a kheer or something like that. Of course, it is going to be sugar free. If you want to add sweetness, I would suggest not going in for any artificial sweetener, but sticking to stevia leaves or cinnamon, something like that. Please do not have honey, jaggery, brown sugar, unrefined sugar. All of that is sugar. It's not going to help you with your diabetic management. So cut out all of that and just go for natural sweeteners like stevia leaves or cinnamon, just to enhance the taste. Then we come to the next slide, where I've mentioned the most important pointers. The last two slides and I'm done. So yes, good carbohydrates play a very important role. I told you, don't go for no carbohydrate diet, go for low carbohydrate diet. Avoid whites. We've already discussed that. Nuts, beans, etc. to be included. So protein, very important if you are a diabetic, because I told you there is severe weight loss, sudden weight loss occurs. It's one of the symptoms of diabetes, uncontrolled diabetes. So try, concentrating more on your protein. Try avoiding red meats, high fatty portions. Go for more of protein rich, lean cuts, good quality protein. Limit your saturated fats. Of course, animal fats I already mentioned to you. Go for plant sources. Eat more vegetables which are colorful. More of things like beta carotene, lycopene rich foods. Then have, okay, two more important vitamins that I need to mention here. One is your calcium, and second, your vitamin D. Both are extremely important if you are a diabetic person. Go for fortified milks. There are a lot of fortified flours available right now in the market. So check the nutritional labels. And if it is fortified with vitamin D, it's better to go in for something like that. Most of the soya milk that is available right now in the market is fortified with calcium. So you can go in for that. And of course, I think yeah. So this is done. Yeah. We spoke about a condition called as polydipsia, which is constant thirst. So for diabetic people, water is a big concern. How much of water will you drink at a time? My suggestion here, please do not get up in the morning and say, I've had 2 liters of water early in the morning. It's not going to help you, because the water retention that will be there by the cells in your body will only be as much as the body requires. The rest of it is going to be flushed out. So through the day, slow and steadily sip through the water and keep a target of minimum 2 to 2.5 liters of water every day. Go for infused waters. Please do not go in for sugary drinks. If you're going to be having tea or coffee, like I had already mentioned, go for stevia leaves or cinnamon. Sports people, if you are into marathon running or doing some kind of sports and you're diabetic, you have to definitely consult a dietitian and take advice from her as to what non-sugary sport drink you can go in for. There are a lot of companies that have come up with innovative energy drinks, for especially for diabetics. So you can definitely contact us and get it across. Limit your salt, blood pressure, we had already mentioned. Alcohol, we've already discussed. And multivitamins, vitamin D especially, along with calcium, extremely important for you. This is the summary of your dietary advices. But before I close for today, I want you to be alert about these conditions. One, your neuropathy, which is your nervous system. If you get hurt somewhere and you're not able to feel it, if there is numbness, if you've got hurt and you have not realized you have got hurt in a particular place in your body, then you definitely have to be very, very alert about it. We have retinopathy. I've already discussed about, diabetic eye. If you look at the inflammation that is there in the diabetic eye diagram, you will realize, how much of problems it can cause. you can end up having surgeries like cataract, etc. Glaucoma can take place. So it's very painful. Sight is extremely important. Windows to the world. Take care of your eyes. Kidneys, we have already spoken about, the load that the kidney can go through. And here I've mentioned one more additional thing, which is mostly ignored by most of us, is foot care. So in diabetes, especially, cleaning your foot every day, wash it, moisturize it, dry it out, make sure that there is no water stuck in between your toes. There are spaces in between your toes where there can be fungal infections. Protect your feet all the time. Use a home slipper wherever you're going out. Wear a shoe. Wash your stockings every day. We've seen worse cases where amputation, etc., takes place just because of simple ignorance, and trying to push that condition and saying, not accepting that this is very important. So foot care, big pointer. Please consider this and be alert. All I want to say in conclusion to today's presentation is that diabetes is definitely a very complex condition, and it affects a lot of vital organs. Our goal is to prevent the complications. Development of diabetes can only be delayed. We've already discussed that. Numerous opportunities are there. So let's just hope that, like I've mentioned here, one day I would love to say, and I will want you to love, I would definitely want you to also say that I used to have diabetes, which means we are really waiting for a treatment to eradicate and eliminate diabetes from our lives. Let's pledge to good health. And this is me wishing you all the very best. Thank you very much for patiently listening to me. Preeta Kiran from Nutrition on Your Plate.
Thank you so much, Preetha ma'am. I'm pretty sure everyone is stoked listening to your presentation and definitely going to pledge for good health. We have lots of questions in Q&A as well as in chat box. Right. So if you want, I can read them out to you and you
Please.
Can answer them.
Sure.
So the first question is, what alternative food to eat for sugar cravings?
Okay. So see, what happens is in diabetes, sugar cravings are very, very common because, like I mentioned, there is either a spike or a sudden drop in your blood sugar levels if you have uncontrolled diabetes. Always make sure, even if you have sugar cravings, go in for something natural. So grabbing a fruit, okay, any favorite fruit of yours, even if it is, let's say, a chiku or watermelon for that instance, you can have that. That's one of the most natural sources of sweet tooth. People would want to grab a fruit, so go for that because it has fiber also. Or what you can do is you can try taking remedial things, like, just for example, we add a lot of fiber. It can be husk, it can be isabgol to a particular person's diet, just because that person gets up in the morning and the first thing he wants to have is a fruit bowl. So a papaya bowl he wants to have to start off his day. So then we tell him to have a glass of, a spoon of husk with a glass of water, and then have his papaya. So the sugar release can be controlled. Adding things like cinnamon to a bowl of fruits, or going in for natural chickies. Okay, you can go in for peanut chicky, almond chicky. These kind of products can be had. Okay, having plain chana or rajgira along with a piece of jaggery can also suffice your sugar cravings. My suggestion always, I want to tell you, is to grab a fruit. So if you're really wanting to satisfy your feeling of sugar cravings, I will suggest you go for a fruit. Again, can't go for a very large quantity. When to have, what is your medication timing, what is the activity you're going to do after that. So early hours of the morning, maximum till mid afternoon is what I will suggest you have a fruit.
Thank you so much. The next question is, should people with diabetes do early dinner? Or perhaps what is the best time for dinner for people living with diabetes?
So we saw two cases here in my slides where I mentioned one person who is insulin dependent. So if you are taking insulin, a particular unit, then of course you'll have to finish your meal within that time span. So if you're having a quick action insulin, shot, then within the next half an hour, you need to finish your diet. If not, if you're having a long lasting one, you know that the morning hours are the maximum release and the evening hours are the least amount of insulin that is going to be released. So if that is the case, you can time it according to what kind of insulin you're having. If you're not on insulins and if you're just taking a pill, okay, and like I mentioned, people who have sleeplessness or sleep apnea, they're snoring, there's disturbed sleep, etc., even having a glass of milk with a protein a bar maybe, or a chicky, or having a fruit just before you go to sleep. You can even have a bowl of a Greek yogurt or something, add some berries to your normal dahi and have it. I'm fine with it, even just before going to sleep. But it depends on what condition or what symptoms you're going through. Okay. But at large, yes, a early dinner is always preferable. Why? Because in especially in the case of diabetic people, the kind of food that you're eating, if you're sticking to the plate that I suggested, then your sugar release is going to be slow. Okay, for the next 2-3 hours the digestion process gets into place, etc., and then you can have a bedtime snack and then sleep. Even if you don't have any of the symptoms, if you are diabetic, before you go to sleep, please have a small portion of something, let's say a makhana bowl, okay, or even having a suka bhel. Okay, we are all watching Netflix and whatnot every day. Midnight, it's like a ritual to finish something, some serial, some series, and then go to sleep. If you are watching and you're feeling drained just before going to sleep, please snack on any of these items. Popcorn, which is unsalted, made at home, you can easily go ahead and have it. A cob corn also is fine with me. Have a small portion and then go to sleep. So timings don't matter. And again, sorry, we are also talking to a lot of corporate employees here. So I don't know which project you are on. If you are on a Australian project or an American project, we don't know what timings, people are following. So I would suggest have a proper dinner with a proper portion 2 to 3 hours before your bedtime. And just before your bedtime, if you're diabetic, have a small snack and then go to sleep.
Thank you so much. I'm pretty sure they must have gotten their answer. The next question is, I frequently get low sugar. What should I do?
So if you're one of the first slides that I showed you is your drop in energy levels or low sugar. So even if you're hypoglycemic or hyperglycemic, it is a sign that you need to go and check your blood sugar levels. Check your blood sugar levels, and especially the one that I told you, HbA1c levels. If you get that glycated hemoglobin levels checked, I'm sure we'll come to a conclusion whether you are in the pre-diabetic or the diabetic stage, and then we can take actions accordingly. But if you are feeling constantly low sugar, there are chances that you may be anemic also. So there are so many small little conditions that are associated with diabetes. Check your blood pressure, check your iron levels. You may be deficient in vitamin D or calcium, and this can cause you getting into this category. So there are so many avenues right now for us to check why you are feeling this low sugar. Also check your diet. If you are loading yourself with simple sugars in each meal, then there are possibilities that once you eat, you're fine for some time, and then suddenly there is a drop and you're feeling low. So lots of factors that you can actually work around.
Another related question is, my sugar levels keep fluctuating. What should be the ideal diet for me?
So if your sugar levels are fluctuating, means yes, 100% it is something to do with the kind of diet you are taking in. Go for more of complex carbohydrates. So instead of let's say just having a wheat roti, add a little bit of soya flour to your atta or besan to your atta. Make it a little more complex. You can add just bran to your your atta. When you're actually kneading the atta, powder flax seeds, add it to your. So there are so many small little things that you can do. Make a methi paratha. Okay, instead of just having a normal paratha, make a methi paratha. You have chana dal paratha that we make at home out of leftover dal, previous day's dal. That is a good source. So these kinds of complex complex form of carbohydrates will help you in your constant rise and fall of sugar. Also mindful about protein. So each meal there has to be a protein food, whether it's a plant source or an animal source. If you can't find any, if you're a vegan, if you're following a particular kind of a diet, then my suggestion would be just buy some pea protein powder. Add 1 teaspoon to your dal or your chas that you're drinking. Sattu is a good drink that you can have. So just let's say 1 hour before your meals, having a sattu drink is as good as, helping you with your sugar spike. So these small little things that you can start including will help you.
Thank you. Another question is of a person who is saying that he has high BP and is under medication. So he monitors the BP regularly, like 2 times a week. So how often should he get screened for diabetes?
Okay, so if your blood pressure levels are more than 140/80, okay, for more than 3 months, then you will have to get your sugar levels done. So 140/80 is the cutoff. So if it is constantly higher than that, and if it keeps fluctuating, then you should go for a sugar test. Any which ways, most of the corporates nowadays do at least an annual checkup, definitely. And like I had mentioned, if you do your HbA1c levels once in 6 months is as good. So getting one test done and just determining whether you're diabetic or not is going to be as easy as this. So one, your corporate office is going to do it for you, and the other one, you are just simply going to go and get one test done for yourself.
Thank you. Another question is, can COVID trigger diabetes?
Yes, COVID, yes, of course, can trigger a lot of other complications as well. We all know that the immune system, okay, is highly susceptible to COVID. So once either you've undergone the COVID condition, definitely in immune system is hampered. And if that is the case, your antibodies of your body go down, the fighting capacity is down. Again, that leads to your neuromuscular problems. You may not have that sensation of you having any kind of infection or hurt or anything. You might end up having everything to do with COVID, is right from your hair loss to anemia to diabetes to cardiac problems. Yes, COVID definitely makes an impact. It does make an impact.
Okay. There's a question, how to take care of your eyes. I believe the person has diabetes and they are saying how to take care of your eyes.
Eyes. So eye care, of course, is very important. First of all, as a diabetic, trying to maintain your sugar levels constantly is a big task. It's a day-to-day thing. Um, Keep monitoring your sugar levels. I'm sure if you're a diabetic, you must be checking your sugar levels at least once or twice in a week. So you'll have to make a graph for yourself and see where what is going wrong. Like I had also mentioned, there's a continuous glucose monitoring device that is available. So if you have that patch with you and you're trying to monitor it continuously, nothing like it. Please use the technology. It's easily available right now in the market. Indian market also has a lot of devices that they have come with. Whatever is budget friendly, go for that. Keep a check on the sugar levels. In for the eye care, the only thing that you can do is maintain your sugar levels. Secondly, of course, cleaning your eyes, protecting your eyes from direct sunlight ho gaya or pollution ho gaya. All of this you'll have to definitely take care of. And if you're feeling any kind of blurry vision or some kind of pricking sensation or solidification or redness, immediately go to an ophthal or eye specialist, and I think they will be able to help you best.
Okay, the same person has also asked that his mom has hypertension, but she also sometimes has hypotension. So is this normal?
So what happens is there are again two conditions, right? Hypo is loss of the blood pressure goes down totally. There you will have to administer a little bit more of salts, etc., in to get her to a normal BP. And in hyper, it shoots up. So if you find in particular, because I'm a dietitian, I have to discuss about the diet. If you feel when you're consuming a particular kind of diet, okay, a day a particular thing is made, let's say she has added pickles to her khichdi on that particular day, or had a side dish of papad, etc., and then it is spiking, please try and avoid the salts. And if she's going extreme where she's not adding salt at all to her diet, okay, and there is an imbalance of electrolytes in her body, then there are possibilities that she's going through hypo. The best thing here to do is to measure the amount of salt she can have every day, so which is 2.4 grams per day. So whenever you're cooking food at home, after cooking, don't put salt in any of the foods that she is going to be having. Take out her portion, give her that 2.4 grams, 2400 mg, as per the WHO guidelines and the American Dietetics Association's guideline. Go for that. Also, I will want to show you, if I'm sharing the slide, the DASH diet that we spoke about. You can actually refer to that. So this diet, the one, can you see my cursor? The DASH
Yeah,
diet.
it's visible.
Yes. I think you should highly, try and implement whatever has been mentioned here. It's an amazing, world renowned diet. It was the best diet for the year 2021. So you can refer to that. And of course, if you want more help, you can come and visit me anytime.
For sure. Ma'am, the next question is, will intermittent fasting help reverse diabetes?
Okay. So now, as a dietitian, there is so much of a challenge nowadays, because every day there is a new diet coming up. Internet, Instagram is filled with new fundamentals, and some diets work for some diets don't work for some. People who have done a particular kind of diet and got results have become self-proclaimed gurus, as we call it. To be very honest, fasting traditionally, we are all Indians. Fasting has been a part of our culture. We've been doing it on and off for religious purposes as well as for health purposes. Intermittent fasting is a very good regime to follow. But in diabetes, again, it totally depends on how controlled your sugar levels are. So if you are a person who is undergoing hypoglycemia every other day, and if you're going to fast for, let's say you have, the most common one is, I think, 16-8. So if you're going to fast for 16 hours and eat only for a 8 hour window, there are very many chances you might end up into diabetic coma. Please do not do any self induced googled diet, please. I will strictly advise you. And in this platform, I cannot say intermittent fasting works, but not for a diabetic person, unless we know what kind of medication, what kind of lifestyle, how much of calories he's taking in, what carbohydrates he's taking in. I cannot comment whether it will work for you or not.
Okay. There is an inquisitive question which is asking why weight loss leads to improvement in blood sugar.
Okay. So when we talk about obesity, a person who has a BMI, that is body mass index, more than 35 is considered to be obese, and 30 above is in a stage where it can be reversed, which means he can lose weight in the normal way. Normal way is eating lesser calories input, and output is more calories. And that is how the fat storage of your body is utilized for the energy requirement. Now, when you are diabetic, okay, sorry, when you are obese, what happens is your visceral fat levels go up. There's a constant tension to the vital organs of your body. The vital organs of your body are not giving their maximum output, so the nutrients are not reaching the cells. If there is no permeability of nutrients, there is more insensitivity, or let's say resistance to insulin production in your body, and the insulin levels keep on going up. If that happens, the sugar levels will suddenly start dropping because it has not reached the cells at all. So if you are obese, if you have a larger surface of your body, even with your blood flow, the heart requires a lot of energy to pump so much blood to such a large area. There is constant threat to the heart also. So not only are your cells your neurotransmitters and your heart affected. Again, like I mentioned, if there is any excess hormone, excess toxins are produced because the levels are imbalanced, kidney is also loaded. So all three vital organs are loaded, and that may hamper. And obesity, that's why, is a cause for you know, getting into diabetes. So if you have high blood pressure, if you have any other complication, you may end up, I told you 80% of people who are diabetic have some other condition as well. So it cannot be diabetes alone. There can be possibilities that cholesterol levels are high, for all you know, or they are vitamin D deficient, like I mentioned earlier also. So every person who is vitamin D deficient is also in the pipeline to get into the diabetic bracket today.
Okay. I will be clubbing. There are a lot of questions regarding the sugar. So I will be clubbing all of them. So there are questions like, is sugar-free sugar just a misnomer? Or is sugar-free sweeteners bad for health? Can a diabetic patient have fruits which are rich in sugar like mango and banana? Like can they consume natural sugar? Then another question is, what are your thoughts on Coke and Pepsi Zero for patients of diabetes type 2?
Okay, so all of these questions summed up, I'll tell you again. We'll talk about sugars. Okay, sugar alternatives are there in the market. First is white sugar, which we have been using traditionally, you know, the bleached one that comes in the market, the normal sugar. Then we have the brown sugar. We have jaggery. We have organic jaggery powder. We have palm jaggery. We have manuka honey. We have organic honey. We have honey from some Netherlands and Germany and Australia and whatnot. And we have organic farm, vegan honey and whatnot. So there are a lot of brands, there are a lot of options as sugar alternatives in the market. To be very honest, all of these are sugar, end of the day. Each gram of any of these sources that I've mentioned is going to end up giving you 4 kilocalories, and they are empty calories, which means they only give you carbohydrates, they only give you sugar. Yes, honey has micro minerals in them. Jaggery, which is organic, which is not processed enough, has micro minerals, but the micro mineral quantity is so less that we can substitute that from other foods also. So you need not go in for jaggery to get that extra iron or magnesium. Okay, you need not go in for that honey to get that extra zinc or selenium or something like that from that source. So if you are a diabetic, cut down on all of these sugars totally from your diet. This stands as it is. If you want to really enhance your taste buds and pamper your taste buds with sweetness, the only 2 or 3 alternatives that I mentioned was stevia leaves, which is a plant. Okay, the leaf dusts are available. You can put it in boil the water, close the gas, put these leaves, very minimal amount, half a teaspoon, not more than that. Strain the water, have your tea, coffee, your kheer, whatnot you want to have, desserts, in that stevia extract. Stevia oils are available, stevia, small tablets are available. If not that, if you don't want to go in for stevia, you can go in for cinnamon, dalchini. That gives a lot of sweetness. Okay. People have been using it for ages now. In Indian food, we have been using it for everything. Even in our tadka, it goes for making pulaus and biryanis and shahi curries, etc. So you can use dalchini powder. Sri Lankan cinnamon powder is one of the best that is available in the market. Go for that and use that for sweetness. And to be very frank, if you really have that sweet craving, I'll tell you one trick. Chew your food slowly. The roti that you're eating, once you start masticating, you digest it in your mouth for some time. Of course, the saliva is going to, it's amylase, and it's going to cut down the enzyme. It's going to cut down the structure of carbs that we are eating through roti. Chew the roti for at least 40 times, and you will feel the sweetness in your mouth. Take an apple, that has sweet, carbs in it, that has sugar in it. You also mentioned about whether we can have high sugar fruits. I told you just now that there is something called as the glycemic index and glycemic load. So I'll give you an example. Grapefruit, which is there in the market, I think one bottle of grapefruit juice is around $500. Okay, its glycemic index is 25. Less than 50 is safe for diabetic, so you can go in for grapefruit. Against which apple, which is 100 rupees probably for 3 apples, the glycemic index is 35. So you need not go in for expensive grapefruit, which has come from America. You can simply have our Kashmir apple that is available any supermarket. For $100, you get 3 apples. You can divide it in 3 days. All your sugar cravings will be controlled. Make a apple pie. You can boil, mash it, add a little bit of, stevia or cinnamon, like I mentioned. Even if you want to, if you can't compromise on that sweetness, add a little bit of jaggery, no worries, but cut down the portion size. Then if you go for a bowl, cut it down to half and satisfy your taste buds. Anything that you eat for 20 minutes and more, your brain gives a signal that you're full. So do that. Eat slowly, chew your food properly. Everything has carbs. So that sugar rush that you're feeling will go away if you're mindful and if you chew your food and eat. When you're watching TV, when you're on your mobile, and if you're eating, it's not going to help us. Time and again, I've been telling myself also, why to shy away from the fact. Even I keep telling myself, don't watch anything, just concentrate on the food. If you do that, half the things will be solved. You will actually feel satisfied mentally also, and the brain will send the signal that I'm full and my sugar cravings or whatever I had, the desire is gone. Do not have any form of sugar if you are a diabetic.
Okay, I'm pretty sure, and we have also shared the glycemic index image in the chat box itself, so other people can view it to
Okay.
understand. A question is there any way we can improve insulin generation in our body? Is there any specific food type that can help in improving insulin spike or manage diabetes?
Okay, so first thing, we cannot push our body or pancreas to produce more insulin or anything like that. Our body knows exactly when and how to release the insulin hormone. What we can do is, yes, control the spike of insulin in our body. That can be done only through high fiber diet. So if you are including a lot of raw veggies, steamed vegetables, fruits, dietary fiber through cereals, grains, multigrains, these are the foods that will help you in controlling the spike of insulin in your blood. This can help you. Protein food also helps a large amount in controlling the spike of insulin. Now, there are certain other fundamentals called fat first, etc., which have also shown results, but it has still not been backed by proper research. So I will not be commenting on that right now. But yes, by large, fiber helps in controlling the release of sugar spike or insulin spike in your blood. To do with enhancing the insulin production, sorry, we will not be able to do that. Only pancreas will be able to do that.
Okay, thanks. Another question is it okay to always get borderline diabetes in blood tests at 27 years of age? Also, when there is a strong paternal family history of diabetes.
So when we saw this particular chart, if you see here, I'll just take the cursor. If you see here, factors you cannot fix. 45 years and older, you cannot fix, but you are 27 years of age. So what you can do is, you can improve your height to weight ratio if you are on the obese category. If not, if you're physically fit, improve your activity levels, try and control the cholesterol, and keep a check on your blood pressure, sorry. So if you do all of this and follow a healthy lifestyle and avoid smoking, I think that will help you push your chances of you getting into diabetes. You're already in a pre-diabetic stage. This is high time, and you are in a reversal stage right now. So at least you can try to push. I said there is no cure. you cannot escape diabetes, but you can push which age you will end up having diabetes.
Thank you. I will be clubbing some of the diet related questions.
Yeah.
So, is quinoa a good alternative for rice as a replacement? Is keto diet good for weight loss when one is diabetic? And is normal atta good for diabetes, or should we boycott it totally?
Okay, first question is quinoa against rice.
Yeah.
So, so let me put it this way: whether you have rice or quinoa or bajra, jawar, oats, any of these carbohydrates, whether you have any of these, if you combine it with a protein, if you're making quinoa upma or quinoa khichdi, and you're making rice upma, rice khichdi, or rice pulao or biryani with a protein, paneer or something like that, it's as good as the same. They have very little, minimal micro nutrients that are plus or minus in each one of them. The most common question I get is brown rice and white rice. Today they've asked quinoa and rice. So if you feel you like the taste of quinoa, if you feel you can afford it in your daily lifestyle, you can have it. But even if you don't have it, if you have your normal traditional diet, also it helps. Second question you asked me was, can you just tell me what it
Uh,
was?
it was related to, is normal atta good?
Ah, normal atta.
Yeah, or
So
we should boycott it.
somebody else had asked me whether, how can I enhance or improve my sugar spike. So if you're having atte ka roti rose in the house, you've been having it for the last 30 years, and today you've suddenly switched to a rice bakri or a jawar bakri, and you don't like the taste, please, you don't have to do it. It's okay to have gluten in your diet as a diabetic also. In the atta, you improve or enhance it with a little bit of, like I mentioned, husk or soya flour, add besan, chana dal. You can add some seeds to it. You can go in for stuffed parathas where you're putting, let's say, shredded paneer or tofu to it. You can have atte ki roti. There is no need to stop it. Just try and enhance the nutrients that you will get from a simple roti to something that will help you even in, again, somebody had asked me about insulin spike. Flax seeds also help in controlling insulin spike. Chia seeds help. So you can start incorporating these things. Just add a spoonful of soaked flax seeds or chia seeds to your dal, mix it in your dal ka katori and just have it with your food. Absolutely fine. So that solves the atta problem. What's the third question?
It was related to keto diet.
So we also spoke about what diets will help you best in the control of diabetes. Of all the fat diets that are there in the market, I have mentioned clearly here, these are the three particular kind of diets that will give you maximum benefit. You want to go in for a keto diet, you have the time to measure each amount of protein or fat and go on these large amounts of fat load or protein load, and you're still able to manage. To each his own. But as a professional, being in the industry for 22 years as on today, I will not suggest you to go in for keto diet.
Okay, thank you. We will be taking the last question, and if there are any other questions, they can redirect us through email. The last question is it possible to reverse the pre-diabetes condition to normal for age 45 years and above?
So again, going back to the same slide. So if you see factors that we cannot fix. So if you are 45 above and you are in the pre-diabetic stage, all you can do is do the checklist, whether you smoke, whether you have alcohol, whether you're eating a lot of fatty foods, whether you're having excess salt or sugar in your diet, whether you are physically active, do you go to the gym, are you into, a little bit of lean building, are you muscle toning, are you doing other activities? Are you physically fit? Do you have any other medical conditions? So if you're tick marking on all of this, all you can do is postpone the onset of diabetes in your life. Like I said, my friend, in 2050, every second person, maybe we are two of us in the camera right now, one of us are definitely going to be diabetic.
Okay, thank you so much, Pritha ma'am, for sharing your wonderful insights with us. I'm
Pleasure.
pretty sure everyone is stoked and excited to learn so much about diabetes and bust the myths together. So thank you so much for
Thank you,
associating.
audience, for listening to me patiently. All the 70 of you, I'm really indebted. And please do visit my profile, check what I do, and encourage me.
Yeah, we have shared Pritha ma'am's Instagram account on the chat box itself. You can even DM her on Instagram or message us or email us, and we can share her details with you.
Thank you.
Thank you so much.
Bye.
Bye.